So before I'm going to performing the nail and hand nails and toenails cutting, the definition of nail cutting is one of the nursing care and general care of a personal hygiene is to cut the nails in the foot and the hands. So the purpose of cutting the fingernails and toenails is first to keep the nails clean. Second is to um make make neatness. Also to prevent the client's skin from scratching. Also, lastly, to avoid the infection from dirty nails. So before I'm going to do the or performing the care for hand and fingernails, I'm going to um, illustrate all the equipment that I'm going to use. First is the barrier. So the barrier, I'm going to place it in the bedside of my patient. The purpose of the barrier is to catch all the wet or liquid materials in the procedure. So another one is the bath basin. So as you can see, my bath basin have a water, so that the purpose of bath basin is to store the tap water, and the purpose of tap water is to soak the hands of my patient. So other one is the soap to clean the hand of my patient. Another one is the lotion for the moisturizing of the hand of my patients. Washcloths to scrubbing in the lesions of my patients. Another one is the dry towel to dry the wet hand of my patient. And another one is the orange stick. I need to remove all the excess or dirt in underneath of the nails of my patient. Nail cutter to cut the excess nails of my patient. Also the emery board to file all the edges of the nails of my patient. So in cutting the nails of my patient, I cut in a straight line, and very careful, because if the patient have a diabetes or something that this is might cause an infection, it will be um it will be a deduction for your assessment. So um before I'm going to demonstrate the care of hand and fingernails, I check the privacy of my patient first, because it's a must, and also do the hand washing or hand hygiene. And of course, knock knock.
Come in.
So good day, Miss Marian. I am your nurse for today, and I'm going to I'm going to care do the hand care for you, for your one hand. Is that okay for you?
Yes, sir.
How are you for today? How are you for today, ma'am?
I'm good, sir.
Okay, so I'm going to um get all the materials that we needed in this procedure. Is that okay for you?
Sure, go ahead.
Okay, so face first is the barrier. I'm gonna replace it in your bedside. Okay. Are you comfortable, ma'am? Comfortable, ma'am?
Yes, sir.
Okay, so the bath basin with water. Can you check the temperature, ma'am? Is that okay for you?
Yes.
Okay, thank you. So So, ma'am, I'm going to put your hands in the water and after washcloths. It's okay here because we need it to scrub the washcloths in your hands. Are you comfortable, ma'am?
Yes.
So, I'm going to put soap and scrub in your hand carefully, finger by finger, as you can see in the video, between the fingers, okay, the palm, and I must say the hands of my patient is now clean and soaked in the water again. That one. And I'm going to replace the hands of my patient in the wet towel for to remove the other liquid materials in her hands. So like this one. So I'm going to use the another washcloth for remove the other dirt, the hands, palm, and now I'm going to use the wet towel to clean the or dry the dry towel to remove all the wet materials in the hands of my patients. So now I must say that the hands of my patient is now okay. So I'm going to cut the excess nails of my patient in a straight. Yeah. Are you okay, ma'am?
Yes, sir.
Is anything to bother you? Anything bothered you?
No. None.
Okay. So in cutting the nails, we always be careful. So now I'm cutting the nails of my patient. So now I'm going to use the orange stick to remove the dirt underneath the nails of my patient. So
None.
mhm. So now I remove the dirt underneath the nails of my patient. Now I'm going to use the emery board to file the edges of the nails of my patient. So now I'm done using the emery board and file the edges of the nails of my patient. So now for the last procedure, I'm going to use moisturizer or lotion and scrub it in the hands of my patients. So in putting a lotion in the hands of my patient, we need to um we need to look in the between the fingers of my patient just to be sure to that the lotion is scrubbed properly in the palm, and now the hands of my patient is now okay. So there's anything to do, ma'am, for you?
No, sir.
Are you
Thank you.
comfortable now, ma'am?
Yes, sir.
Is anything to nothing bothered you?
Nothing.
Okay. Any pain?
No.
No. Okay. So give me time to clean the environment and going to wash all the materials
Yes.
we use. Yes, that's all for the videos. Thank you.